I'm Joseph Guggenheim. I'm a 1972 alum of the medical school, and my topic this month is epidemics in Chicago. Have we learned anything from the epidemics over the past 200 years? Did we handle COVID correctly? Let's see, and I would let you decide. This is a picture from the Tribune of a child receiving an inoculation for the polio vaccine back in the mid-1950s. Epidemics became a part of daily life in early Chicago, starting back when Chicago was first founded in the 1830s. There were waterborne diseases, cholera being the most important, and the communicable diseases, starting with polio and smallpox, all the way through the past 200 years to COVID and HIV. These were originally blamed on miasmas, which were bad odors. The germ theory was not widely accepted in Chicago until about 1877. Let's first look at cholera. Cholera is an acute infectious intestinal disease transmitted primarily through contaminated food or water, or occasionally by flies. If left untreated without fluid or electrolyte replacement, death may occur within a few hours, as little as 12 hours. There were 3 primary epidemics in Chicago, and they all were thought to arise in India. We don't know the exact starting and finishing date of epidemics, so these dates are just approximate. The first one being 1829 to 1832. The second one starting in 1849, which was considered the deadliest. Anywhere from 3 to 5.5% of the population died in this epidemic. And the last one being in the Civil War years, starting in 1863. The first epidemic started in 1832. This occurred when federal troops were sent to Fort Dearborn at the mouth of the Chicago River in response to aggression by Black Hawk. This was probably an unnecessary military expedition because the aggression was nearly ended before the troops' arrival. But cholera broke out on their way to Chicago. Before they reached Fort Dearborn at approximately Buffalo, New York. Once they arrived in Chicago, they brought it to the civilian population. Treatments included bloodletting and calomel, a mercury compound, and one doctor was proud that his death rate had declined to only 29%. The second epidemic occurred starting in 1849, and this was thought to have been brought by immigrants on boats from New Orleans. Others blamed immigrants who were working on the Illinois and Michigan Canal, the waterway that was going to connect the Mississippi River tributaries with Lake Michigan. The city did not know the etiology of cholera, but recommended a cleanup campaign, including shooting dogs that were running loose or unmuzzled. A cholera hospital was opened at Jackson between Clark and State Streets. Naturally, the nearby residents objected. This would have been in what is now the Loop. During this epidemic, treatments were based on bloodletting, opium, mercury, stimulants, and tartar emetics. Some people blamed poor nutrition. The newspaper, the Chicago Democrat, recommended avoiding coconuts, cherries, and whiskey. The Chicago Board of Health recommended avoiding fresh pork, fish, fruits, veal, vegetables, nuts, green corn, and cucumbers. And they even reported one woman who had died after eating hot biscuits. Plans for a city water system were begun. The third epidemic started in the Civil War years in 1863. A committee of physicians blamed impure and damp air, unwholesome food and water, excessive use of stimulating drinks, meaning whiskey or other alcoholic beverages, and neglect of personal hygiene. They advocated an aggressive neighborhood cleanup campaign, including the establishment of public urinals to keep men from relieving themselves on street corners and in alleys. Dr. Daniel Brainard, the founder of Rush Medical College, died of cholera in 1866 after symptoms for about 12 hours. Rebuilding after the 1871 fire led to improvements in the water system, including the sewer system and the water distribution system. With the improvements in the water system, there were no more cholera epidemics after this. So now let's look at smallpox. There are 2 theories of origin by the World Health Organization. First one being the most probable one, according to that organization, that humans were infected by a variola-like virus from rodents anywhere from 16,000 to 68,000 years ago. There was evidence of smallpox in ancient Egypt. Pustules were found on the face of the mummy of Ramses V, who died in 1157 BC. And you can see a picture of his mummy on the right. An effective vaccine was developed by Edward Jenner in England in the late 18th century. He demonstrated that cowpox inoculations could confer immunity to smallpox. Vaccine is actually derived from the Latin word for cow because of the origin of the material from cowpox. Vaccination complacency arose even though there was an effective vaccine. The complacency arose in both the US and Europe. So there were resurgent epidemics in Chicago, as well as New York City and Quebec in the 1830s. The first serious smallpox epidemic hit Chicago in about 1848, and physicians volunteered their time to vaccinate the population. The next epidemic occurred a little later, 5 years later, in 1853 through 1855, and it was blamed on the immigrants. Smallpox was brought to Camp Douglas, the prisoner of war camp for Confederate prisoners between 1862 and 1865. And at that prisoner of war camp, there were more than 2,000 cases with 618 deaths. The epidemic spread to nearby Chicago and lasted for about 5 years. Workers coming to Chicago to rebuild after the Great Fire of 1871 brought smallpox with them, resulting in an epidemic that began in October 1871, the same month as the fire, and lasted until May 1874. The mortality was terrible, more than 25%. An immigrant brought a single case in December 1879, triggering an epidemic which lasted until 1882. When this epidemic was finally controlled in 1882, there had been 1,292 deaths in a city with a population of about 500,000. Smallpox was reintroduced in 1892 to 93 by the large number of domestic and foreign immigrants that were coming to prepare for the Columbian Exposition of 1893. Health authorities successfully controlled each outbreak until November 1893. And by March 1894, Chicago had reported 578 cases, 1/3 of all the cases reported in the US. The cases continued to increase despite that Chicago having more public vaccinations than any other city in the country. Another epidemic arose in 1894. It was a particularly brutal winter, and Chicago faced economic downturns like they hadn't seen in years. By May, there were more than 1,400 cases, definitely a bad year for Chicago. And this epidemic was blamed on being spread by workers who were infected with smallpox working in these sweatshops, making clothing and coats. John Rauch, who was the founding president of the Illinois State Board of Health, said that no immigrant should be allowed to come to this country from Europe without being vaccinated before embarking, owing to the prevalence of smallpox in Europe, reminiscent of the COVID era. Hospitals were where some patients sometimes contracted instead of recovered from smallpox. There was a place built that was called the Pest House, short for Pestilence House, on the Potter's Field in what is now Lincoln Park. It is where the softball fields are now, as you can see in this picture, near the intersection of North Avenue and Lakeshore Drive. The Potter's Field was where indigent people were buried. The Pest House burned down and was rebuilt several times, first being built in 1843. On the right, you can see a clipping from the Chicago Tribune, courtesy of Pamela Banos, who is a faculty member on the Evanston campus, who's done extensive research on Lincoln Park. Smallpox was eradicated thanks to an effective vaccine. The last wild case of smallpox in the US was 1949, according to the Illinois Department of Public Health. The last case in Illinois was 1947, and the last case in the world was 1977. Now let's look at polio. There have been 3 major phases of polio. the first being the endemic phase from antiquity to the 19th century, then the epidemic phase, which began in the mid-19th to the mid-20th century when an effective preventive vaccine was discovered, and then the vaccine phase beginning in the mid-1950s to the present. Polio has been seen in this Egyptian seal monument, which shows this picture of a man with a short, small right leg and a deformed foot. This dates back to approximately 1400 BC. King Tut may have had polio. This is a CT scan of his feet. You can see the left foot is smaller and crooked compared to the right. Polio virus is unique and made it difficult to develop an effective vaccine. It requires a human host, and therefore, but the virus does not survive outside the body for more than a week or two. It could only develop when humans started to settle in large groups with increasing population density. It is transmitted via the fecal-oral route. Crowding and poor hygiene led to its spread. Sir Walter Scott had polio in 1773 when he was an infant. It was so rare at that time that a London pediatrician described a new disease, a debility of the lower extremities, in 1789. And in the 60-year period from 1808 to 1868, there were less than 30 cases reported worldwide. So why the rise in the 20th century? Well, before flush toilets and safe drinking water, children were usually exposed to the virus before their first birthday. But until their first birthday, they were protected by their maternal antibodies. So virtually all children would contract the virus before their first birthday, but they were still protected by maternal antibodies, so they did not develop the paralysis and the disease. Improved sanitation, paradoxically, drove a rise in cases. Exposure to the virus before losing the protection of the maternal antibodies meant an increased chance, or exposure to the polio virus after losing the protection of maternal antibodies meant an increased chance of getting polio. This resulted in an increased number of cases and increase in the death numbers around the turn of the 19th and 20th century. The age at which patients were contracting polio also increased. President Franklin Roosevelt did not contract polio until he was 39 years old, but that was before he was president. The first major epidemic of polio in the U.S. occurred in the small New England town of Rutland, Vermont in 1894. There were 132 cases with 114 that were paralyzed, a huge percentage. Researchers isolated the virus in 1908, but they did not know the method of transmission and also did not know how to culture the virus outside a living organism. In 1916, there was an epidemic resulting in 27,000 cases and more than 6,000 deaths. Chicago in that year had 1,000 cases. People panicked. They left the city during the summer for resorts. Groups canceled meetings. Theaters were closed. Children avoided swimming pools and public drinking fountains in 1918. Camps were suspended and beaches were closed. Cats and mosquitoes were thought to be carriers, resulting in spraying toxic DDT and killing unnecessarily 72,000 cats. People feared that children would contract polio from telephones, library books, and paper money. Insurance companies sold polio policies to parents of newborns. An attempt was made at suppressing polio by the use of quarantines. Anderson, Indiana, established a blockade on Muncie, Indiana, where polio was epidemic. Anderson turned back more than 400 cars from Muncie that were headed toward Anderson. In 1949, motorists that were driving through San Angelo, Texas, feared that putting air in their tires would result in taking the virus home in the air in the tires. Schools were taught by radio, and this was considered very innovative. It got a lot of publicity both in 1937 and also during the COVID pandemic. The public schools were closed by the Chicago Health Department in 1937. And the superintendent and assistant superintendent initiated an experiment to bring instructions into homes via the radio. This required a coordinated effort of the schools, the public libraries, and the radio stations. Several radio stations donated their time in 15-minute blocks for school instruction. Broadcast schedules with times, dates, directions, assignments, and questions were available every morning in the local newspaper, and a sample is seen in the clipping from the Tribune on the right. Students could find lessons for their grade level. Monday, Wednesday, and Friday were devoted to social studies and science. Tuesday, Thursday, and Saturday were devoted to English and math. Attempts were made to keep the lessons informative and entertaining, but there were problems. Parents were encouraged to call in with their questions, but the problems included some families did not own radios. Families with multiple children needed multiple radios, and some children needed more attention than others. It was thought that those that benefited the most from radio instruction were probably those that needed it the least. Even though this got a lot of publicity in 1937, as well as during the COVID pandemic, it was discontinued after only about 3 weeks. Let's look at the incidence of polio in Chicago. As I said, first epidemic in the US was in 1894 with 132 cases in Vermont. 1916 was the next epidemic, 27,000 cases with 6,000 deaths in the US. Chicago had 285 cases with 49 deaths. 30 years later, there were almost the same number of cases in the US. There were about 2.5 times as many cases in Chicago as there had been in 1916, but the number of deaths remained the same at 49. In 1952, which was the worst year for polio in Chicago and in the US, there were more than 60,000 cases with 2,000 deaths in the country. Chicago had 1,208 cases and 82 deaths. The human trials of the Salk vaccine began in 1952 with almost 2 million children involved. Mass injections began in 1956. 1956 was the second worst year with 1,111 cases in Chicago and 36 deaths. Even though the polio vaccine had started, it was not available to a large number of children before the polio epidemic, before polio season during the summer of 1956. This is an article that appeared in JAMA as a 16-page landmark article. The senior author, Herman Mundison, was the commissioner of health for the city of Chicago. He was a Northwestern Medical School graduate. There were some interesting findings from this article. The highest incidence, as I said, was 1952. There were 33 cases per 100,000 population in Chicago with a fatality rate of 6.8%. The second highest incidence was 1956 with 29.2 cases per 100,000 population. The fatality rate had been cut in half to 3.2%, one of the lowest in the United States. It was discovered that previous tonsillectomies increased the chance of bulbar paralysis, and the injection site increased the chance of same extremity paralysis. But the article concluded that this should not really be considered when giving the vaccine because full immunization led to almost 100% prophylaxis. This is a map of Chicago from the 1950s. There was a higher, and each black dot represents a case. There was a higher incidence in the non-white population. You can see a large concentration on the near west side due to a combination of poverty and increased population density. Lower socioeconomic neighborhoods had a higher incidence, as seen by the black dots, with a lower median age group, lower median age, 3.5 years. The higher socioeconomic groups, like the north side, had a lower incidence, yet a higher median age. The March of Dimes was the nickname for the National Foundation for Infantile Paralysis. The term was suggested by the entertainer Eddie Cantor to mimic the contemporary newsreel term March of Time, the black and white newsreel that was shown between features in movie theaters. The National Foundation relied entirely on voluntary donations. It did not take any government money. They funded treatment of acute polio, the follow-up for patients with residual paralysis, and also funded the research which was responsible for the development of the vaccine. They singled out one disease, which made it seem more ominous and yet more curable than other diseases. I'm not trying to minimize the severity of the polio epidemic, but there were 10 times as many children that were killed by accidents and 3 times as many killed by cancer. But still, polio, in the eyes of a parent who had a child with polio, was devastating. The Salk vaccine results were revealed in a meeting with scientists and journalists at an auditorium in Ann Arbor, Michigan, at the University of Michigan. The date that it was revealed was April 5th, 1955, 10 years after the death of FDR to the date. The National Foundation was accused of doing this for publicity purposes. Within hours of the revelation, 532 pounds of Salk vaccine arrived at Midway Airport, designated for first and second graders. In October 1955, additional vaccine arrived for children 5 to 14 and for pregnant women. Chicago was one of the first cities in the U.S. to receive a significant amount of the Salk vaccine. The Salk vaccine was tested in almost 2 million children in the U.S. Actually, the Sabin vaccine was tested in more children, but Sabin was not allowed to test it in the United States, so he tested it in foreign countries, including the USSR and the Belgian Congo. This is a picture of children in Lombard, Illinois, taken from the Tribune, where they were given cookies after they received the Salk vaccine in 1954. They then received a certificate signed by Basil O'Connor, who ran the National Foundation. He was an attorney, personal friend of FDR, and Harvard grad. Children were given the certificate as well as a little button which said they were a polio pioneer. I was in this group, and I remember receiving my little button, which I kept very proudly for many years. The last wild case of polio in the US, according to the CDC, was 1979. In other words, those that were not associated with the vaccine. The last case in Illinois was 1983. The last wild case of polio brought into the United States was 1993. Vaccine-derived poliovirus outbreak occurred in an unvaccinated Amish community in Minnesota in 2005. There were 162 cases in the US in the 20-year period, 1980 to 1999. 8 cases were acquired outside the US and brought in by travelers, none since 1993. There were 154 vaccine-associated cases caused by the oral polio virus. There was a scare that there might be a possible case in an unvaccinated traveler in New York in July 2022, but that was an unfounded fear. The Nobel Prize was awarded for polio research in 1954, not to Sabin or Salk, but to John Enders on the right. Dr. Enders was a PhD. He was not an MD. His PhD was in English from Harvard. He admitted he had trouble with math and physics. He declined to accept the award unless his co-researchers, Thomas Weller and Frederick Robbins, were also given an equal award. So the 3 were awarded the Nobel Prize in Medicine and Physiology in 1954. So what have we learned? How are we going to handle the next epidemic? When will the next epidemic occur? And when will we handle it any better than the last ones? Only time will tell. I'd like to apologize for an error I made last month. I said that the 2 McCormicks that were on the organizing committee for the Century of Progress World's Fair were relatives of Robert McCormick, the inventor of the Reaper. It was Cyrus McCormick who invented the Reaper. They were related to both Cyrus and Robert. Robert was the publisher of the Chicago Tribune newspaper. I'd like to invite everyone to come to Chicago for Alumni Weekend, October 13th and 14th. There's a chance to reunite with some of your classmates, see what's new on our campus, enjoy tours of Chicago landmarks, and receive some CME hours. So let's get together again virtually next month. In the meantime, stay healthy, stay connected with each other, and I look forward to our virtual meeting then.